Alright, so now I'm going to be discussing about ABDM, which stands for the Ayushman Bharat Digital Mission, which is India's national digital health infrastructure created by the National Health Authority (NHA). So it provides a federated, patient-centric, interoperable digital health ecosystem that allows or enables digital health records in forms of EHRs, that is electronic health records, digital health identities using the ABHA health identity card, nationwide interoperability, secure consent-based data exchange, standardized data formats using FHIR, registries of doctors, hospitals, health facilities, medications, right? Health lockers for personal records for every citizen, and digital prescriptions, telemedicine, and insurance claims for all. So ABDM Ayushman Bharat Digital Mission is actually a nationwide public digital platform for healthcare. Like UPI is for payments, Aadhaar is for identity, ONDC is for e-commerce, and ABDM here is for healthcare. So it provides public digital rails on which hospitals, apps, insurance, labs, and pharmacies operate. So why was initially ABDM created, right? So India's healthcare system ecosystem was or it still is fractured, non-digital, data not portable, and patients carry files manually. Doctors are not able to access previous reports manually. No nationwide registry of healthcare professionals, and health apps do not talk to each other. So what ABDM does is by basically it integrates all these things together. It creates the unique patient identity card using the ABHA medical card, a standardized digital health record system, nationwide registries, consent-based data sharing, and uniform health data standards, right, for FHIR. So its architecture, it basically uses a federated architecture. There is no central storage of patient data. Data stays with hospitals, labs, and doctors. Sharing occurs only via consent, and data moves through Health Information Exchange, that is HIECM. Records follow FHIR standards. All right. So ABDM architecture has multiple layers. First, it has the identity layer, and it has the ABHA, that is the health ID. So it's a 14-digit unique health identity for everyone who registers. It is like a UPI ID, but for healthcare. So, for example, Sargun at ABDM, right? And ABHA address like the health wallet, endpoint to receive records. Then we have the registry layer, which is firstly containing healthcare professionals registry (HPR), which has verified doctors and nurses, lab techs, and pharmacists. And secondly, health facility registry (HFR), which has hospitals, clinics, labs, imaging centers, right? So both are mandatory for digital ecosystem participation. Then we have the consent layer, which basically is handled by the consent manager, the ABDM gateway, and HIECM. So functions are to generate digital consent, track consent lifespan, revoke consent, audit trail, and zero knowledge architecture. So it uses DEPA, that is Data Empowerment and Protection Architecture principles. Fourth, we have the data layer, which has a health data types like clinical notes, lab results, radiology, prescriptions, vitals, diagnosis, immunizations, discharge summaries. And the standards used are FHIR R4, LOINC, SNOMED CT, and ICD-10. Also, we have the health lockers, which are personal digital vaults for health data. This is similar to DigiLocker. It stores lab reports, prescriptions, and discharge summaries, and the patient controls the sharing. Then we have network layer, which is powered by the ABDM gateway and HIECM, that is Health Information Exchange and Consent Manager. It handles requests, authorization, fetch requests, tokenization, and notifications. So how basically does the ABDM data flow? We're going to be looking at that. For example, a lab uploads your report, and we need it to appear on the ABHA lockers. So let us see the 7-step flow. Firstly, the patient gives the ABHA number during registration. Then the lab or hospital requests consent via the ABDM gateway. So consent is pushed to the patient's app. After that, the patient approves the consent with his PIN or authentication ID that he receives. Then the lab packages data, converts to FHIR, and then encrypts it. So FHIR JSON file is generated. Then the encrypted data is sent to the health locker. Only the locker will be able to decrypt this data. And finally, the notification is sent to patient that your new report is available, and the patient can share this report with the doctor because he has the consent, like he has the ability to share the consent request with the doctor so as to access the document, right? So that's the 7-step flow. Moving on, components of ABDM. So firstly, we have the ABHA address and ABHA number. So ABHA number basically is denotes your identity, and ABHA address is basically the communication endpoint. So the analogy is that ABHA number is like your phone number, and ABHA address is basically your WhatsApp account. Then we have consent manager. For example, Arogya Setu, Paytm Health, Briefcase, Eka Care. Their functions are to collect consent, generate tokens, track timelines, audit logs, and revoke anytime. Then we have the health information provider (HIP). Any entity generating health data basically has to be registered under this HIP, health information provider, that is hospitals, labs, telemedicine apps, or pharmacies. Then we have health information user, any entity that is requesting health data like doctors, specialists, insurance companies, or government health programs. Then we have the health locker, which stores your lab reports, prescriptions, vaccination records. So it uses DigiLocker type architecture only. Then we have the PHR, that is personal health records app, which is like your banking app but for health. So functions are to grant consent, view reports, download your own data, track your health, see your history, right? See history of medications, appointments, etc. Now, standards used in ABDM, so it ensures semantic and syntactic interoperability using FHIR R4 for structure, SNOMED CT for diagnosis and clinical terms, ICD-10 for billing and morbidity, allowing for labs, and DICOM for imaging. Now, benefits. So, for patients, ABDM allows for all health records to be placed in one place for easier access. Then, no need to carry files. Again, accessibility, prevents duplicate tests, saves cost because everything is digitalized now. You don't have to maintain everything on papers and reports because you may lose them. So it saves cost as well. It allows for full control over data sharing. For doctors, access to relevant history, better diagnosis, better continuity of care, and easy accessibility. For hospitals, integration with HIS, LIS, automated report sharing, reduced paperwork. For government, again, reduced paperwork, real-time disease surveillance, better policy making, and nationwide uniform data. Now, challenges of ADM: digital literacy gaps, non-standardized hospital IT systems, privacy concerns, low adoption by small clinics, and connectivity issues in rural India. And that's it.